Hello and welcome everybody. I'm Anthony Gonzalez and I'm the Senior Program Coordinator with the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. And I want to welcome you all today to our webinar titled Communication Toolbox, Building Effective Strategies for Alcohol and Drug Prevention Communication. Our presenters today joining us are Dr. Jenny Damask and Allison Thumel. Before we get started with today's session, I do just have a couple of housekeeping slides I'd like to share with everyone. Here on the screen should look somewhat familiar as we are in the Zoom webinar format. We do welcome your questions throughout the live session today, but we do kindly ask that you utilize the Q&A feature. We do have the chat enabled, so please feel free to introduce yourself and share reflections and resources as it relates to today's content. But again, we kindly ask any specific questions you have for our presenter that we try to use the Q&A feature. Additionally, we have captioning enabled for today's session. You can turn that on through your bottom dashboard. If you have any issues getting it set up, feel free to send me a message and I will try my best to walk you through that process. Also encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different membership tiers and the benefits that go along with them by visiting our website at hecaod.osu.edu. We also have a few upcoming events that I'd like to share with everybody. Our next free webinar will be taking place on January 21st, and we'll be focusing around planning alternative sober programming on campuses. Our next free webinar after that will be taking place on February 25th and is titled, What Comes Next? Developing a Transitional Program to Promote Sustained Recovery Success Post-Graduation. And we have a save the date for our new prevention professional training. This is a 3-part series and we'll be launching in the coming days, but will be taking place in March. So we ask folks to stay tuned and we'll be posting more information on our website in the coming days. And with that, it is my great pleasure to turn it over to our presenters today. Joining us today is Dr. Jenny Damask, Assistant Director for High-Risk Drinking Prevention at the University of Wisconsin-Madison. And joining them is Allison Thumel, Associate Director of Marketing and Health Communications with the University of Wisconsin-Madison. Thank you both for being here today, and it's my pleasure turning it over to you at this time.
Thank you so much. We're just going to share our screen, some slides. One second. Fantastic. Okay. So, so I'm Jenny Damask. I use she, her pronouns, Assistant Director for High Risk Drinking, and I'm just going to have Allison just do a quick introduction again of herself.
Hi, everyone. I'm Allison Thumel. I use she, her pronouns. I'm the Associate Director of Marketing and Health Communications at University Health Services. Oops, sorry. I think our presentation got started a little bit early. So I'll kick us off with our goals for today. So I think everyone here has an interest in either communication or alcohol and drug prevention or both. Our goals for today are that you leave the presentation with a better understanding of what makes an effective communication strategy as related to alcohol and drug prevention. So we'll talk about the importance of strategic communication as part of your alcohol and drug prevention strategy. We'll talk about what makes up a communication plan, and we'll talk through some tools that you can use to build your own communication plan. And then we'll show some of that strategic communication planning in action, walking through a case study from the University of Wisconsin-Madison, where Jenny and I both do alcohol and drug prevention work. So we're hoping that you leave this presentation feeling empowered to include communication as part of your alcohol and drug prevention strategy, no matter how big your team is. We understand that teams have all different sizes, all different resources, all different capacity. And so we're hoping to share some principles and tools that you can use and embed into your existing work, so that communication isn't just kind of something you're adding on top of everything you're already doing. It's a way to kind of integrate into your approach moving forward.
Okay, so this is a beautiful picture of the University of Wisconsin, located in Madison, Wisconsin. And we are a Big Ten Research 1 institution. Undergrad population about 35,000. Our graduate population pushes up to right around 50. So pretty large institution. We are in Madison's an isthmus, so we're surrounded by water. And if you look on that shoreline that's closest to your computer, that whole shoreline is a bar. So people can definitely drink on our campus, and they definitely do. Our alcohol prevention is really an important part of what we do. It's the number one drug used by students, and so it's an important area of work. And drugs and alcohol, really important area of work for us. Okay, so a little bit more about us. Um, we are a full service student health center that is student fee funded. So, students pay a segregated health fee, and that makes a pretty big budget for us. And we have medical services with, psychiatrists, medical providers, doctors, nurses, MAs, PAs. So, it's a pretty good operation, 2 floors of a building, several specialty clinics. We have mental health services, which is 1 floor of our building, and we have about 100 mental health professionals. And then there's our prevention team, which has about 19 full-time professionals, and we concentrate on 3 areas: suicide prevention and mental health promotion, gender violence prevention, and then my area, which is alcohol and other drugs. We also have a pretty big administration team. So Allison is on our communications and marketing team within University Health Services. And prior to just last week becoming the associate director of our marketing communications for UHS, she was just a sole communication strategist working with prevention. So we have a communication strategist for each of our main areas: medical, mental health, and prevention. So very good working relationship there. A couple data points I want to point out. About 37% of our students drink at a high risk way. So that's 4 or more for females, 5 or more for males, defined on the NCHA survey, which we did in spring of 24. 28% of our students said they used nicotine or tobacco in the last 3 months. 38% said they used cannabis in the last 3 months, and we are not legal as a state on either level. And then we do see some disparities in our data. If you were at the HEC-AOD National Conference, you saw the keynote Rhonda Washington gave on the color of drinking study, which really does show some disparities. Students of color don't drink as much as our white students, but feel some of the impacts around safety, sense of belonging. Just non-drinkers in general feel more lonely and like they belong less. So definitely an area that's really important for us to look at alcohol use on the spectrum from non-drinker to high-risk drinker or individual in recovery. Okay, so just a note. So I was a long time ago, I was trying to come up with a graphic that helps people like understand the way I see our alcohol and drug prevention activities. I really work on things, approach my work from a policy system environment level. So we do, and communication is a part of our entire like spectrum of our work. So environmental management pieces, trying to change the environment. An example of that is like getting Narcan available on campus, like changing something in the environment. Policy and enforcement. So we're always thinking about how we can have strong policies and enforce them and let people know about those. So amnesty policy is an example. Prevention education, we have several initiatives around this, including first-year education and RSO education that is required. Early intervention, we do basics, K6, choices, those kinds of programs that happens in our mental health services. And then recovery support, we do have a recovery program. So this is kind of just a model. It's not cited, I just made this up, but it just tells the work. And what's so important about this presentation is that communication really has to be a part of all of these areas, because it's not just enough to have a policy. You need to communicate about the policy or communicate about enforcement. And when you have something that you change in the environment, you have to tell people about it. So it has to be a part of all of your strategic prevention initiatives.
So I have been working in college health for the last 2.5 years. Prior to that, I worked in change management and communication consulting, which involved helping organizations go through large changes. And so communication was a big part of all of that. And that was, a focus on helping people at all levels of an organization prepare for changes that were large, changes that were small, any kind of changes in like processes, benefits, systems, anything that could happen in an organization. So this is kind of the perspective that I'm coming from when I approach communications. And when I started working in college health and working with Jenny on an alcohol and drug prevention framework, I found a lot of uh, complements between a change management approach and a public health approach. Both are focused on behavior change at their core, which is really, really important to consider when you're thinking about communications. I think when we hear communications, a lot of times what I hear as a communicator is people saying, we just need people to know about X. Like the goal is always informing people. But for behavior change, you have to work on that like policies, systems, and environment approach. And so you have to think about things like we're trying to reach students, but we're also trying to communicate to everyone else who reaches and touches students. We're trying to communicate about the campus environment, about campus policies. And so aligning that like prevention framework with the way that you're communicating about changes is the way that you can drive really effective communication change. So today, what we're going to talk through is elements of a communication plan, but a communication plan that is rooted in behavior change. So action, not just knowledge, is kind of the foundation of everything that I do communication planning wise. So communication for supporting behavior change has a few different principles. So on the left of the screen are change management principles related to communication. And this is kind of how I think about like this from a communication standpoint. So like from a change management approach, we're trying to create behavior change. So we want to communicate about the change. Do we want students to change their behaviors around nicotine use? Yes, we do. And we want to also do that continuously, right? We're not just having like one communication campaign or like, one Instagram post, one email about nicotine cessation. That's something we have to consider throughout the year, and especially targeting that as particularly high risk times of year when we know, alcohol use, drug use, nicotine use, when they peak for students. We also have to involve stakeholders at all levels of the organization. So using the example of nicotine and tobacco, Jenny and I have been working, we worked on a series of grants related to nicotine and tobacco cessation. We had to involve stakeholders at all levels of the organization. So it included partnerships with like the Office of Sustainability, working with faculty and staff. So it's not just students. Our students are our primary audience, but there's a lot of other audiences we have to consider in order to reach students. We also have to make sure our communications focus on like organizational culture, mission, and vision. Like they have to feel like those messages apply to our particular audiences. Every single university has their own culture, mission, vision, things that resonate with students. Like this varies regionally. This like varies just depending on a lot of different factors, school size, for example. So not only do we need consistent messaging, but we also need messaging that resonates with students. And then we also need to think about what's motivating for students. So, using the example of nicotine and tobacco communications, like, we've learned from focus groups that health messages don't always resonate with students, but messages around money or like what their families will think, or, focusing on like building strength in the gym. These messages resonate with them a lot more than like lung safety, for example. And so knowing that really helps us drive more effective communications in those areas.
Okay, so we're going to get into talking about some tools that you could use on your campus for doing communication planning and strategy. And for each tool, we're going to use example from a case study that we did on campus. So in fall of 2022, we installed 12 boxes containing Narcan in campus housing. We had an opportunity then to expand that in August of 2023, so almost a full year later. And we added 13 boxes throughout campus for a total of 25. And this included places where, we were very strategic in selecting like the library, gyms, union. And then in March 2025, we added yet another 10 additional boxes, making our total 35 and likely where we'll be for a while. To make Narcan more available on campus. So we're going to use this as a case study because this is a really great thing to do strategically on that environmental management level. Like we're changing the environment, making it more accessible. However, it needed a really solid communication plan. And so we're going to teach you about tools and how we use them for using this example. So communication planning at a glance really kind of follows this metric. So identifying audiences, developing our message, selecting channels, building the plan, and then measuring success. So we're going to take a look at this a little bit. Before we get into it too much, we're going to actually take a look at the final step, which is measuring success. So really wanting to like this will, because this is going to inform the whole process. So really being able to set goals, what do you want to achieve, and how will you know if you're successful? So we really wanted to know this for Narcan. So our first tool actually that we're going to introduce you is actually a goal dashboard. So this is where this tool is one where you would take a look at like, what are you working on? What problems are you trying to solve? Your communication goals. What do you hope to achieve? Can your goals be as smart as possible? And then what are your measures, both quantitative and qualitative modes of measurement. So when we did this for the case study, Narcan, the background is the same. You know, we wanted to install these boxes, and this change really made Narcan more available and easily accessible to the entire campus, including faculty, staff, students, visitors, right? And so UHS, University Health Services, aimed to announce the change, expand the overdose awareness, educate the campus community, and help them find where the Narcan was on campus. So a couple communication goals we had was to inform students, faculty, and staff on campus of the Narcan availability. A goal was to increase access to Narcan on campus and promote overdose awareness. So some of the measures we chose that we were going to look at, and some of these involved adding more questions to existing surveys, but we were going to look at page views and reach, social media engagement. We were going to look at the box utilization itself, because these boxes they went on Wi-Fi, so they let us know when they're opened, so we could have individuals go and check the box and refill if necessary. And we do that through partnership with Environmental Health and Safety, who check all our fire extinguishers and AEDs. And so we were also going to look at some of our data too, by adding extra questions on the NCHA survey and LCAL EDU, because we'd be able to get students' knowledge before they were incoming into campus on LCAL EDU, and then about 6 weeks later they take part 2. So we'd actually get to see if any knowledge or information increased during that time around Narcan. So just a couple measures that we were really aware of, that it desired some planning, especially with LCAL EDU and NCHA, to get some extra questions on there.
All right, so now that we have set goals, we can begin diving into communication planning. So the first step in communication planning is identifying your audiences. So that means asking who you're trying to reach, what unique needs do different parts of your population have. Folks like to be reached in different ways, but different parts of our student population have different communication needs. And then who can help you achieve your prevention goals? So the way that I like to think about this is kind of as I mentioned. So communication is not just education. Communication is not just focused on informing people. I think there are 3 main different types of audiences that you have on your campus. So audiences who need to be informed. These are folks who need to be aware, educating people, giving them the facts, in the Narcan situation, making them aware of Narcan availability. There's people who need to be influenced, and these are people who need to take action. And so what this is moving beyond just education or knowledge, like there's an action we need to take, and all of our communications are geared toward getting them to take that action. And then there's people who need to be involved. Their support is needed in order to reach our prevention goals. And so our communication needs to loop them in a way that involves them and lets them know how they can support this effort. So this gets to our next communication planning tool, which we call our audience analysis. So for many universities, this framework captures a lot of different groups that you might consider in your audience analysis. So different student groups, groups of faculty and staff, university leadership, your campus health organization, other campus departments or organizations that may be involved, and then other groups who might fall outside of the university. And so, as I mentioned, these are not all audiences that, need to be like informed in terms of like broadly communicating about the change, but they are people that might be in some of those influence or involve audiences. So here is what that looked like for our case study of Narcan on campus. And I'll pass this to Jenny to speak a bit more about this.
Yeah, so it was really important for us to figure out like what are all the groups that need to know about this particular message and just really make a really comprehensive list. I think a lot of these groups we really wanted to inform, but we also really wanted to understand where they already were. Yes, broad promotion was going to be a big part of it, but kind of part of that broad promotion was understanding like what audiences knew what because we were starting this, in 2022. So it was relatively in the news about like fentanyl and fake pills, but I mean, I don't think the word Narcan is even as it is today was as known. And so one thing that we really wanted to do to make sure we understood a little bit as we were identifying audiences was to understand a little bit about what audiences know. So if you go to the next slide, Allison, we definitely did looking at all of our different channels and our audiences, we wanted to know like, okay, what do people know? What can we do? So we decided on a focus group. And we were able to do that over the summer, which isn't always the easiest, but we definitely had quite a few people. We wanted to know prior knowledge, belief and biases. We wanted to really know about language and terminology, and then access to channels. So yeah, we want to reach students, but where are students in the residence halls getting their information, or where are graduate students getting their information? Like we have all these different channels we want to use, but like where do you get your information if you are in this XYZ population? So yeah, we offer $10 WIS card deposits. So it's just $10 added to their student ID that they can use on campus. And we filled all of the focus groups that we had with that incentive. I think there are a lot of low capacity options if you don't have any money. You could use existing groups or channels. So if you work with peer educators or work with RSOs. So sometimes you can go in for informal. Sometimes you just have students who work for you. So yeah, informal feedback is really, really helpful too. And then sometimes your partners have access to email students a survey or something like that, or get you into a staff meeting for RAs. So a lot of low capacity options where it's not as like built out as maybe a formal focus group. But this really, really, really helped us influence like just where are we starting from, what knowledge base with the audiences.
So now that we have identified who we're communicating to and just have assessed their base level of knowledge, we can move to developing messages. So this is a stage where we think through what messages are needed for each of the audiences we've identified, all of those with different types of involvement, right? So the inform, influence, or involve audience types. What messages are the same across some of those groups, and then what messages are different or more targeted, right? So there's some broad messages we're putting out across campus, but there also might be people who need a little bit of a different communication approach. Um, so this is, I think, one of the most useful tools. If you take any tool from today, I think this is the tool that's the most helpful for bringing back to like any of your planning exercises. So this is a tool that I call no feel do. It seems very simple, but it can be very impactful in terms of like understanding what you need to focus on in terms of communication. So the way that this tool works is we start actually at the right side of the tool. So what does a particular audience need to do? And so this is grounding all of our communications in action, right? So even if you think like this is just a particular initiative where we need to like educate or increase knowledge, there's always an action associated with this. So, we need students to take action to prevent overdose. And so, in order to do that action, what do they need to feel? They need to feel empowered. They need to feel that this is relevant to them. Jenny will get into a bit more detail about, what we considered as we were planning our messaging for this project. And then, in order to, feel those things, in order to do those things, what do they need to know? And this know column, like where we kind of end up after we've kind of figured out what the action and what the feeling that folks need to have is, that helps us create our messages. And these messages are what you can use to build your communications. So this helps us kind of move from just like, there's a lot of information out there, a lot of alcohol and drug information can be very complex. Like we are like as an alcohol and drug prevention expert, you have a lot of expert knowledge, but it also might mean you have a lot more knowledge than maybe is what we need to like have folks focus on in order for them to take action and to move forward with what we need them to do. And so this kind of helps like filter and focus all of that knowledge and information and also break it down in the most actionable way for your audiences.
So no field do is my jam. I really, really love it. And I'm thankful for Allison for introducing it to me. I'm going to go through this no field do for students, but we picked a particular audience when we were filling it out. So starting with do, what do we want students to do? We want them to recognize the signs of an overdose. We want them to locate the nearest box location to them or know where they can locate boxes. Carry Narcan with them as a preventative measure if they or a friend might need or were at risk of an overdose, and administer Narcan and in an emergency and call 911. That's what we want them to do. What do we want students to feel? That they have power, knowledge, and ability to save a life, that overdose is an issue that could affect them or someone they know. It's not far away. It's not an unrealistic thing. It could happen. That Narcan is safe and highly effective at reversing an opioid overdose, and that it is important to be prepared and act quickly in case of an overdose. So that's what we wanted people to feel. What do we want students to feel? Students, what we want them to know that Narcan is free and easily accessible to them for emergency use or to take and carry in case of emergency. Where Narcan is located on campus. We want them to know how to use Narcan. We want them to know signs of an overdose. And we want them to know that there are risks of fentanyl and opioid overdose, including drug lacing. When I first was approached to work on, opioid overdose, fentanyl overdose, I was kind of all over the place, I have to admit. And so I have felt that way too with cannabis, honestly. It just feels like an overwhelming thing. There's a lot of research to say that what's effective, but where do you start? And I have to say, when I do a no field do, and we just recently did one for cannabis, it is so helpful because it helps you focus in your campaign, your strategies, your information, and what you want to be communicating out. And so we went from an initial reaction campaign to a very particular strategy that helped us really allow us to frame in what we want to do for this particular, communicate for this particular prevention, environmental management piece, adding boxes. So this is a really helpful tool, and I use it all the time, and I can't say enough good things. I always say this is my jam, the no field do. So very, very thankful to Allison for introducing it to me.
All right, so we'll move to the third step of communication planning. So now that you've identified who you're communicating to and what you're communicating, this is the stage where we identify our channels and identify how we will reach those audiences with those messages. So in this step, we'll think through what channels exist already within your organization, and think through how you can utilize existing modes of communication to meet your audiences where they are right now. You might just be thinking I'll send an email, I'll make a poster. I think those are very familiar, well-utilized different channels that we have. But there's a lot of other different great ways of communicating that exist on your campus that can increase your reach. Here's just a few examples. So channels to look for that are very common on different campuses. Social media, whether your health center or other organizations on campus have, an Instagram, a Twitter, Facebook, print materials, posters, postcards, flyers, stickers. These are great for handing out at outreach events or having in the campus environment. You also probably have a lot of digital communication options. So in addition to your website, we frequently utilize PowerPoint slides or digital TVs that are in different campus spaces like libraries, in housing, in our clinical waiting rooms, in our recreation facilities. And those get a lot more traction a lot of times than print materials, particularly on our campus. Newsletters and email lists, I think, are one of the best ways that we get out information very broadly on our campus. We have almost 50,000 students on our campus who receive just a lot of communications all the time. And so there are a lot of targeted newsletters that are held individually by different departments, identity centers, advisors that get a little bit more of a targeted message. It's a trusted messenger that's providing that information to students that they will pay attention to. This also allows us to rely on campus partners to help us get the word out, right? So we reach out to advisors, we reach out to campus communicators, we have distribution systems that we reach out to kind of filter that information so we're not the only ones who are sharing that information. One thing that folks don't always think about is campus news. Through press releases that go university wide or through student newspapers, a lot of times we'll reach out and build relationships with those student reporters when we have large changes like this. Students are really interested in reporting on student health and new initiatives, and that's been a way we've been able to get the word out really broadly and share some of those messages that we want to share. So you might be looking at this and thinking, wow, this is a lot of communication. This is like so much more than I have like time and capacity for. But I think the thing I want to take away from is these don't all have to be channels that you yourself are owning. Leaning on those partnerships, everyone you identified in that involve category and your audience analysis, those are people who are helping you communicate. So talk to them, find out how they communicate with audiences that they have access to, and see what you can get them for putting out through their channels, whether that's a social media account, whether that's a newsletter or an email list, or another digital resource that they have. Rely on those campus partners and figure out what channels exist in their area, and that will increase your reach exponentially. So our next tool is a channel inventory, and this is just a way of kind of taking assessment of what those different channels you have available to you are. This is not a tool that you have to use like every single project that you're working on. This is something like you can work on and then pull from whenever you're working on a different initiative or project. The channels will be, you'll have like a core group of channels that you'll be focusing on whenever you are pushing out communications. And then you might have additional channels that come up, depending on partnerships as part of that project that you're working on. So in the channel, you'll identify the channel, you'll identify the audience, like who is reaching. Some of these will be really broad. It'll be like, faculty and staff or all students, but then some might be more targeted, like, graduate students or international students, like some of these like more segmented audiences, depending on what you want to communicate. Usually provide a brief description of like what the format of this piece is, and then an overview of timing or frequency. For example, if this is a newsletter that goes out like weekly, every other week, monthly, that just helps you keep track of like when this will go out and the timing based on the timing of your project.
So for the Narcan on campus, we definitely wanted to have talking points for campus partners. We're really big decentralized campus. So I was talking earlier how everyone has their own communications department here. It's not centralized. And so like really making sure that they're all really upstate and knowledgeable and making sure that they've got everything ahead of any kind of launch. Press release, posters, social media, like just kind of thinking about, okay, when do we want to put this out? What newsletters are available? We definitely learned about like Grad Connections, which is a weekly newsletter, is like a really good tool on our campus. And so an opportunity to weekly reach a lot of grad students who are definitely checking that. Whereas there might be other housing has a weekly newsletter, and then there's one that just goes to all students weekly. And so like just kind of understanding all of the different points, and then when we would, if we were, since we were launching to start out in August, when we would want to put something out and how frequently we'd want to refresh that too. So we do newsletters, but then can we do it again the next semester? How frequently, timing and everything like that. So that was important to us as well.
Right. So now we are at the point where we can go ahead and build our communication plan. So we've gotten organized, we've taken a lot of notes on this project, we've thought a lot about audiences, messaging, channels. Now we get to bring all of the pieces together to build our plan. And so this is where we integrate like everything we've already developed and plug it into a plan and align that with events on and off campus, align this with your project timing, and figure out like what cadence makes sense for sending out communications. So our final tool that we'll share is a media matrix. And so this is something where we align both our communication touch points along with events. And so this looks very complicated. It looks very messy, but here is kind of how we break this down. So at the top of the media matrix, that's where we categorize events. So it's adding key dates of events on and off campus, like academic calendar changes, hotspots. For example, Jenny and I work a lot on alcohol communications, identifying when those high-risk drinking events fall. That's something I would put in this kind of events area. National events that provide opportunities for like cross messaging. So this could be something like an awareness day or an awareness month. And then key events related to your project. So if there's kind of like a launch day or like other project specific dates that you want to keep in mind, adding all of those events to the timeline on the top will kind of help you see everything like big picture, how it arranges together. Second, along the left side, you'll add your channels from your channel analysis. So if this was emails, talking points, newsletters, news articles, um, you'll add all of those different channels. If it's relevant for your organization, you can also include things like outreach events or social media. Those are things that I've added along the bottom there. And then take a look at those channels and your events on campus, and you will align those with key dates. So third, in the center of the matrix, you'll be adding when those communication materials will be sent out according to your project timeline and then your overall campus calendar and timing. I would recommend color coding if you can based on audience. So is something going to faculty and staff? Is something going to campus partners? Is something going to students? And that will help you kind of see like at a glance that you're covering all of those different areas and all of those different audiences.
So for this media matrix, we kind of have some specific events. SOAR is like our student orientation, advising and registration. So like new student orientation stuff. But like housing move-in, fall classes begin, we're kind of like putting some of those events up there along with like, new box site. We're going to have boxes on site. We're going to have an overdose awareness day, recovery month is September. So just kind of trying to understand, which you could do an editorial calendar this way too. Just kind of seeing everything. I have done social norms campaigns where I had like 5 social norms messages and I color coded them all. And then each one I was like, okay, we're going to do this here, this here, this here, and maybe all 4 here in a bulletin board and housing, So it's really just helping kind of see like how this is all going to like lay out against some of those high risk drinking holidays, some of those overdose like awareness days. So just trying to map it out. We had like a harm reduction fest in September where we had a lot of partners come together. We have student organizations. We have a pharmacy organization. We have an end overdose organization. So getting them integrated into our system, and they're also doing training. So they help us. So getting them materials when they're out doing their trainings so they can also promote the boxes. So just a lot of coordination. And this is a way for us, this is a tool to help us identify how it all lays out.
And I think an important thing to look at when you're seeing this is communications are pretty evenly spread across the bottom of this grid, right? So even though the new box sites were added in August, that was kind of the go live. We have, a lot of launch and announcement communications in August, but then we're reinforcing that message through a lot of other timely touch points throughout the year. And so that's something that that's another big key takeaway is thinking through, you'll have your opportunity to initially announce and launch anything that you're doing, but then think through when are some other timely opportunities you can promote this. So whether that's an awareness month, an event happening on campus, like something that's in the news, like finding a chance for those timely updates is a really good way to continue to reinforce the message and really important when our campus populations turn over so frequently, right? There's always new students on campus. And so you want to kind of be continuously communicating to make sure that you're reaching all of those newer folks that are coming and may not have received the initial launch communications. So we're going to share from, as Jenny mentioned in the project, when she introduced the project, we kind of had 3 phases for this project. We had the first wave of boxes that were installed in August 2020, fall 2022, a second wave in August 2023, and then a third wave of boxes last spring in March 2025. So we're going to share some materials from those first 2 waves of the launch. And then when we take a look at some of our metrics, we'll share how we adjusted and updated the project and made some additional materials to cover some of the gaps that we identified or opportunities that we saw moving forward. So looking at our digital communications, we did share a press release with all of campus that got picked up by some local news organizations as well as campus news. We had digital screens that were located at all of the places where we had boxes. So in the gyms, in the libraries, in our own buildings and other places across campus. We also shared out a campus partner email that had a resource package, which was just a box folder with digital copies of all of our promotional materials for others to continue to spread the word. We created a list of box locations, and we also created to the bottom right on the screen, our web page also had an interactive Google map with some custom pins on it that allowed us to show in the campus space where all of those different box locations were. We've gotten thousands and thousands and thousands of views on the map. I think that's been one of our most successful pieces that we developed as part of this project. We also did outreach through campus newsletters, and then some social media promotion throughout the last 3 years we've had boxes on campus. For our print communication, we had a couple of different posters. So we had some overdose awareness posters that we shared in housing. And then we also had posters that we shared at box locations. And so the box location poster is on the right of this screen. Just a very simple message. There's Narcan in this building. These are displayed at all of the campus buildings where there are boxes available. For some of the campus locations where the boxes are harder to locate, like maybe they're in a less obvious spot or they're separated from the AED in a building, we provided additional custom messaging that shared where exactly in the building those boxes were located. And then the posters also have a QR code to that map that I shared on the previous page, so folks can find Narcan at other locations on campus. We also developed a wallet card, and this is a piece that we've given out at a lot of tabling events or if we're doing presentations on harm reduction or drugs and alcohol. And this has some quick tips. It's got an overview of signs of overdose, as well as how to administer Narcan, and then also pushes to that map to share where Narcan is available on campus. So after the first kind of 2 box installation waves, we measured success. So we looked back at our goals, tried to think about if we achieved them and then what are ways that we can measure this, and then what adjustments do we want to make moving forward.
Yeah, so going back to that goal dashboard again, what are our goals and what are we trying to measure? So we definitely wanted to inform students and faculty staff the on-campus availability of Narcan. And so, Allison, if you go to the next slide, we were able to track views on our campus map. We were also able to track views on our webpage and FAQs. Google Analytics is kind of like maybe not able to use so much anymore. So we can only go with what we know when we had access to that, but we're tracking it the best we can. We did have 4 media/campus partner inquiries, so definitely was on camera on the news. So that's fun. We had some broad campus newsletter reach, so we're able to see kind of how we're reaching people through the newsletter and what's being opened. We had box utilization numbers, so we wanted to increase access. So we had 16 kits taken our first year, 54 kits taken our second year, and 38 in our third. So we might be hitting our maybe leveling off, or that might mean we need some more promotion because maybe like we've kind of dipped a bit. We have had 2 reports of Narcan being administered to an individual, and which is really, really good. We don't always get that. We don't always know. Right. But we have had lots of interest from partners, and that's really what led to additional boxes. So once we had the first wave, there was a bunch of people contacting us, and we were like, okay, we need to install some more boxes. And then there was even more people contacting us. And there were a lot of people who just wanted to do it on their own, but it's really important that we're trying to kind of like make sure that the communication matches ours. So the more that we can get people to be on board, get them a box if we need to, but get them in our communication. So their box is on our chart, everything matches. So like really trying to coordinate with all these partners. And I was so glad to see so much excitement. And then during overdose awareness, days we promoted, but also we decided we were going to put information into Alcohol EDU. So we're able to reach over 30,000 students over the last several years because we have about 10,000 students who take Alcohol EDU every fall and spring. So we've been able to put that information. And so we've definitely seen an increase in students' awareness of the boxes and just what fentanyl is and what Narcan can do and opioid overdose, reversing that as well.
All right. So once you measure success, that's not the end of the project. So this is kind of a rinse and repeat. Um, an academic calendar is cyclical. We know that, we'll have new students coming. We know that, some specific milestones or times of year, they'll repeat year after year. And so something to do each year is to debrief and then plan, what worked, what didn't, like how can we adjust, add things to our plan, change how we're communicating, and that informs future communication planning. So you'll go through this process kind of repeatedly every year, learning along the way as you go. So because this project was in 3 phases, we had kind of 3 opportunities to adjust our communication planning. Ahead of the rollout of the third wave of boxes this past spring, we added a few additional pieces that have been like really, really well received. So one of those things I mentioned was additional personalized posters. So we were able to see from measuring box site data which boxes were getting a lot of Narcan kits taken and which boxes hadn't been utilized at all. And so we did some additional personalized promotion of those underutilized sites. So these might be sites where the boxes were located, down a set of stairs or, further back in a building to help like wayfinding for folks, and doing some additional promotion. We also shared additional communication materials with staff at those particular buildings in order to better direct students to those locations. One kind of new do that we promoted from like the no feel do exercise, we wanted to promote proactive carrying. I think when we initially promoted this project, we focused a lot more on emergency use, right? You could witness an overdose, you know where Narcan is, you can go to a box and you can get Narcan. A large portion of our student population is located off campus. Only about a quarter of our students live on campus in campus housing. And so part of the reason we expanded access to Narcan on campus, we started in campus housing and then we made it more broadly available across campus. And so we wanted our communication plan to grow as well, right? So not just focusing on folks who had access to Narcan on site kind of 24/7, like where they were living. A lot of our students live off campus in apartments. And so we switched our messaging a bit to promote proactive carrying, letting folks know that they could take Narcan from any of the boxes and keep it with them in their home, apartment, office. And that also helped us reach campus partners who were like, can we get a box? Like, we'd love to have access to a box. We can't have boxes in every single building on campus, but we can promote like departments or individuals to keep Narcan with them if they feel that someone near them could be potentially at risk. So one of the ways that we promoted proactive carrying is we developed a magnet kit. So you can see this at the lower right of the screen. And this is a folding packet. So Jenny is demoing it right now, but it is a folding packet that includes an overview of signs of overdose, like the Narcan program, information on what to do in case of overdose. And it came with a magnet and a removable sticker. And so the goal of this magnet is that to identify like where Narcan is located in a given place. Knowing that a lot of our students live in apartments, they might host house parties, they might have guests or roommates or friends visiting. The magnet says there is Narcan here, and there's a space for writing in where the Narcan is located in your apartment. So, it is in the upper kitchen cabinet. It's located in the medicine cabinet. It's located in the drawer to the left of the sink. And then there's a removable sticker that's located as well within the kit that you can put on the drawer or cabinet door where the Narcan is located, so that even a visitor to that space will know where Narcan is in case of an emergency. And so it all folds up really nicely into a little kit. So they've got information and then those resources with the goal of students also taking Narcan from one of the boxes to keep in their home or apartment or office. So we received really good feedback on those. That was a piece we were really excited about, and I think that really supported that mission of proactive carrying. And then kind of the final piece that we did was just reinforcing that ongoing promotion. We have some students who work on our communication staff that are really excited about promoting harm reduction messages. We partnered with some student organizations to create Instagram reels for how to use fentanyl test strips, how to administer Narcan, and we shared those on social media throughout the year. We also developed a Narcan administration booklet, which is shown at the upper right here, which is just kind of a step-by-step guide for administering Narcan. So we give that out at trainings and presentations as well as outreach events. And it kind of digests like into like a very easy to read format, all of the information that we have on our website and other materials, and promotes proactive carrying as well as the availability of Narcan on campus.
So I just wanted to make sure we included this because, of course, you all know about indicated, selected, and universal prevention. And it's just really important to look at the whole spectrum of what we're doing. So universally, we wanted to make Narcan available and make sure we're advertising it, the Narcan boxes. But we also had free fentanyl test strips in our student activity center as part of our strategy. And so that was also part of later promotion because we got those after we had the boxes. So there are for free. They're in a, what's it called? A vending machine. But they are free. They're just in the vending machine, but it helps us make sure we can like track it and replace it. And then we have definitely promotion of medication take backs near campus. So there are several areas where people can, so there's only one area where people can dispose of medication. That's UWPD. So that's our police department. However, there are like pharmacies at the tail ends of campus where you can also take medication. So we want to make sure there's promotion of just like where you can do it, every day of the year, basically. And so we do further communication on those items on the webpage, campus map, print and education materials, poster. So including those items. Selected prevention. So there are particular times of the year and particular populations we want to focus in on. So we wanted to make sure that Narcan and fentanyl test strips were available for some more higher risk populations. So making sure fraternity and sorority houses had maybe something in their houses specifically that aren't like our boxes on campus, but they have access and training and information. We also are very strategic about our med take backs. We do one big one a year with partners and UW and our police department. And this past year, it's around move out. It's also in conjunction with Earth Day because it's not safe to throw those things away. And so it's a duly promoted thing. And we took about 51 pounds of medication back. So a very good event in a very like particular point in time because people are moving out and we want to take that stuff. So really aligning with some high risk times. We have a block party that we don't endorse. It happens really close and our students go to it. So trying to get some Narcan availability or information pushed out at that time, spring break, Halloween, things like that. Now, for indicated students, it's a little harder to find students who might be more indicated. However, we find that can be done in clinic. And so we do have what's called HOPE kits, kind of takes the name from hospital overdose prevention and education kits. Or sometimes called heroin overdose prevention education kits. But we just call them HOPE kits. It's something that a provider was really, felt really important to have. And so in our clinical spaces, there are kits where there is Narcan, fentanyl testing strips, information on recovery resources, very specific to someone who might be more indicated. So they're presenting in clinic that they may need something and they can give it to them right there and then. We also have medication lock boxes located in our mental health and medical clinic area. So student can get those if they're meeting with a provider and it seems indicated. And then we do definitely poster and digital screens in the clinic areas just to kind of, you can talk to your provider about this, about anything and here's some, ask about a lockbox. So definitely it's part of like the lockboxes and everything was, all of this was a part of a greater strategy. We focused a lot of our energy today talking to you about the strategy on the boxes, but we have communication throughout the entire overdose harm reduction on campus. And so it's all really indicating what we don't want to do is have the HOPE kits look very, very different from the boxes or like feel like we're advertising it different. So very slightly like kind of aligning. So people are kind of like seeing Narcan in a particular way. So there is like strategy in all of this because I'm so glad we're doing it. But like, we don't want you to just throw up a poster, someone to throw up a poster and say, hey, get your Narcan here because it can be confusing. So really trying to get everything aligned. So it's a part of our entire strategy. Communication is so, so important. Now, Allison, I don't know if you want to say anything else about that.
Yeah, I mean, I think that this is just a good way of showing that we're thinking about this holistically, right? So you're thinking about it on a project by project basis, but we're also using some of these other projects that align with different parts of our prevention strategy to like reinforce and reiterate those messages, right? So if we're having a medication take back event, if we're putting out, high risk drinking messaging, we might also be tying in messaging around other harm reduction resources. We'll be bringing some of those print materials. We're kind of using everything we do as an opportunity to cross promote other things that we're doing. So I look at this very holistically. So the media matrix that we create for a specific project, we also might like look at that in terms of like what we're doing like across an entire issue area as well. So I encourage you to kind of scale this like however it works for your strategy, and try to think holistically about everything that you're doing, like for all of those audiences, the indicated audiences, the selected audiences, the universal audiences, and continue to tailor your plans for that.
And I think we're willing to take questions now. I know someone wanted to see me demo the book. So it's very creative, um, pulled out as such. And inside is a magnet, and I dropped the sticker, but because I was demoing it too much. But just a creative way to write, like we know a lot of our students live in apartments a lot. Like basically we can only really house first years. And so just having people write like put this on the fridge and say Narcan is available in the bathroom. And then put the sticker on the cabinet where it is in the bathroom. And that was something that really came from students like, hey, we're at a party, we have Narcan, we want people to know about it. Yeah, we will take questions. I know we only have like 5 minutes classically. There's some in the Q&A. The first one is, did you face obstacles with liability implications? No. And I know that that might be specific to our campus. We had an opportunity to participate. And I feel really, really lucky that there was a program within the state. They had some grant funds. It was 2022, it was a different time. But our risk management and our legal office met. And I can't share the confidential document results, but they did a risk assessment and found it to be safe and definitely something they wanted to partake in. So yeah, sorry. It was easy for us, I guess. Allison, do you know about how much the magnet kits were?
Yeah, not off the top of my head. So we have an on-campus printer that was able to create the wrapper material. It did require like a custom die cut, so there was a bit of setup with the printer. But we worked with a vendor to get the stickers and the magnets, so I could get you pricing for those. So if you want to shoot me an email, I know I've prepared that information for other campuses that were interested in creating this. But I think there's like, there's different options and you can kind of scale it for whatever works for you. We did like invest in that as like a really important tool for us to be able to reach some of those off-campus students.
Okay. So yeah, methods you found to address alcohol in a similar manner. Yeah. So that's probably a really long answer, and I'd love to talk to about that. If you want to set up a meeting. Yeah. I mean, the chart that I made that had indicated, selected, and universal. I have one of those for alcohol. We have a lot of different. What do I want to say, campaigns and strategies around that. We definitely take a policy system environmental approach. We collect a lot of data and have a lot of group work. But yeah, it's so valuable to use some of these tools to understand how we need to be communicating about alcohol, particularly on this campus where it is really accessible and acceptable. So we're competing against two really ingrained and difficult. One's more of a norm and one's just an availability issue. But so some cultural things for sure.
Yeah, and I would say one of the things that like thinking about your audiences and that inform, influence, involve is like really valuable when thinking about alcohol. So I think something that Jenny and I worked on a lot is in relation to just like addressing alcohol culture as a whole. Like in addition to promoting like alcohol harm reduction messages for students, we've been really investing in messages to like the campus community and to campus leadership around, words and actions around alcohol and how that influences the campus environment. So we received a lot of great feedback for an article that we shared last year ahead of the Mifflin Block Party, which is like an off-campus, unsponsored, high-risk drinking event, but it is something that we have a lot of students attending. And we shared an article with faculty and staff ahead of the block party to say, like, you might not think that you influence alcohol culture in your teaching role, but like, here's little things that you say and do that can like kind of signal to students, how alcohol influences them, how alcohol is part of the campus culture, and some guidance from like a prevention perspective on like their role in that. And so that's kind of an area we've been really focusing on and investing in. And I think like thinking about your audiences more holistically and those different roles that they play might help you think like more expansively about like the different roles that people on campus play in influencing alcohol prevention.
Mhm. Yeah, and just running through the tools, just do a no field do with a particular audience, like what do faculty, what do students need to know, field do, and it will really help as you think about your communication strategy around that.
Well, thank you both so much. As you can see in the chat, just all the thank yous, and I'm sure if we were in person, you would be hearing an applause now. But thank you so much for sharing of yourselves and your expertise with our audience. I did just want to share with everybody that today's session has been recorded. You can expect to see it uploaded to our training library within about 3 business days. So here on the screen is a QR code, a great way to connect with us and get straight to our website. So of course, you'll be able to see the session recording in our coming days. Thank you everybody for joining us today, and I hope you have a great rest of your day. Take care all.